We're going to get started. Whoops, sorry about that. We're going to get started in a few minutes. Just want to make sure we have everything working. Looks like Catherine typed in. Sitting too long, walking too long is from Ellen. So I'm hoping you guys can hear me. Just another minute or two, we'll get started. We have a PowerPoint to go through, and you should have received a worksheet by email. If you happen to have that handy, that might help you follow along. If you don't have it with you though, you'll should still be able to follow along. If for some reason you'd like to get the email after the presentation is over, just give the office a call and we'll get that information out to you. Or you can send us an email. And Joanne says that walking is what makes her hip hurt. Just another minute or two and we'll get going. In addition to those of you that signed up for the webinar, we're also live streaming this on our Colchester office Facebook page. All right, so I have it as being 5:30, so why don't we get going with the presentation. I'm just looking for my pointer. But it doesn't seem to want to show that to me here, so we'll just get going without it. So my name's Christy Pasquale, and thanks for signing up for the Hip Pain and Arthritis Workshop, or for anybody that's watching it on Facebook, thanks for watching it. We're going to follow along on the worksheet that we sent you. And before we get going, I did want to introduce our office a little bit. We're a group of physical therapists. Our main office is in Colchester, Connecticut, and our secondary office is in Hebron, Connecticut. We've been around since 1989. One office opened in December of '89, and the other opened in January of 1990. To be honest with you, it was so long ago, I can't remember which office I opened up first, but I just let you know that so that you understand that we've been around for a long time. We're not just a pop-up PT practice. There are currently, sorry that my picture is kind of over Katie's picture. There are 8 of us that are now currently treating therapists in both offices. I'm one of the owners along with Jim Furland, Christine, Katie, Mark, Zuzana, Frank, and Becky all treat with us. Katie, Christine, and Zuzana are in the Hebron office. Katie's the clinic director over in Hebron. Jim is the clinic director over here in Colchester. So there are basically 8 different therapists that are treating patients in both offices. I do like to tell people that in the more than 30 years that we've been open now, we've done over 250,000 treatments. And if there are about 15,000 people that live in Colchester and 10,000 people that live in Hebron, we like to be able to say that we've treated everybody at least 10 times on average. Certainly we service all of the towns and communities surrounding both Hebron and Colchester. So we're going to follow along on the workshop or on the worksheet. So the whole point of the workshop is to teach people how they can get back to normal naturally without medications, injections, and surgery quite often, or at least with minimizing those things. So we're going to start out by defining what the hip joint is, just to get everybody thinking about the hip joint. We're going to come back to these blanks at the end of the thing, but as I go through the next series of slides, we're going to fill in the blanks. So first, we're going to talk about what the hip joint is. So the hip it's a ball and socket joint. Just to get you guys oriented, and I hope you can see my pointer, but over here on the left side, or on the side of the screen where you see the full skeleton, this is just to get you oriented a little bit. The bigger picture, or the close-up picture, shows your hip joint, and it consists of a big round ball that's sitting in a nice deep socket. So what the answer to that question is, the hip is a ball and socket joint. It's a very stable joint. In comparison, your shoulder joint is a very shallow depression with a big round ball sitting on top of it. It's inherently unstable. That's why it's easy to raise your arm up over your head, but it's a lot harder to get your foot up over your head. For the average person, it's because there's a tight socket with a ball that sits inside of it. All right, so we're going to move down to the next question, 1B. The hip joint is supported by muscles on how many sides? And the answer is actually 4 sides. And the point of this slide is to just show you those muscles. So this is looking at the hip joint. There's the ball in the socket underneath that muscle right there. And again, I'm going to see if I can find my pointer. I wish I knew where it was. I guess not. Anyway, and going across the front of your hip joint, those are your hip flexor muscles. So that's one side. If you were to kind of put your hand, if you had pants on and you stuck your hands in your pants pocket, that's right where those muscles would be, right across the front of your hip. So that's one side. Now this is on the inside of your thigh. So this is your thigh bone here. The second set of muscles is going down kind of along the inside of your hip to attach to your lower leg bone. And this is looking at, if we were to peel your skin off from the backside, these would be your buttock muscles here. So that would be on the back. And then the fourth side is on the side. So your hip joint is surrounded by muscles on 4 sides: the front, the inner part of your thigh, the outer part, and then the back. So you have big, thick, strong muscles surrounding your hip joint. And we're going to come back to that, because one of the reasons people's hips start hurting is those muscles get weak. Sometimes they get weak because you have pain, so you stop using them as much and they get weak. There are other reasons they can get weak. If you have a pinched nerve in your back and the nerve's not supplying the muscles will get weak. But the bottom line is you lose support of your hip joint, and that can cause hip pain. So if anybody has any questions as we go along, you can either type them into the question and answer box, or if you'd like, you can just type them into the chat box. And as we go along, I'll try to answer those questions. It looks like we have 7 people on the call now. And at this point, there are no questions in the question and answer or the chat box. All right, so we're going to move on to question 1C. If you're following along on the worksheet, the 4 things that need to work together normally for a pain-free hip are, all right, so these slides are to remind me to say, and so that you understand, as we just talked about on the last slide, are your spine and pelvis. So these are 2 pictures of models of your spine. And if you have a pinched nerve in your back, the nerve isn't going to supply the muscle with the information it needs so that it can turn on and support your hip joint, and that'll cause you to have hip pain. The other area that people know a little bit less about is your sacroiliac joint. And if you can see my pointer, it's moving around where the sacroiliac joint is. You have one on the left side and one on your right side on your back. Your spine is sitting right on top of the sacrum. The sacrum is located in the back between both halves of your pelvis. And where that, whoops, sorry about that, guys. Somebody put a question in the chat and that distracted me. If the sacroiliac joint, it doesn't move a lot, it's not like a hip joint or a shoulder joint, but if your sacroiliac joint is out of alignment or is stuck, that can also cause a number of things to happen that will cause your hip joint to hurt. Now, somebody wrote in the chat, what about arthritis? So if you have weak muscle, everybody gets arthritis in their hip joint as well as in most of their joints as time goes on. And we're going to talk about it because invariably people ask, well, what about bone-to-bone arthritis? The bottom line is if your muscles are strong enough and all the joints working around the hip joint are mobile and flexible enough, even if you have arthritis, even if you have bone-to-bone arthritis, having strong muscles can take enough pressure off of the hip joint so that you can actually live pain-free and avoid extra medications, injections, and surgery. Lots of people, by making their muscles strong, making all the joints move, making sure you don't have a pinched nerve in your back, can get rid of your hip pain so that you can do the things you want to do without any limitation. So the first area, so the answer for 1C, 1 is spine, and 1C2 is pelvis. So those are the first two areas that need to work together normally so that you can have a pain-free hip. That's even if you have arthritis. So the other areas that need to work together normally are your knee and your foot and ankle. So question 1C, number 3, the answer is knee, and answer 4 is ankle. And those joints need to work together because in combination, your spine, your pelvis, your hip, your knee, your ankle, and really your foot kind of act together like springs and shock absorbers. Each time our foot hits the ground, there's a little rotation. Your foot pronates, your lower leg rotates in, your knee flexes or straightens and bends a little bit, your hip bends a little bit, your pelvis rotates a little bit, your spine rotates a little bit. And if you add all those things together, that's how your body dissipates force. So the really big or really important thing to take away from this is that if all of those areas are working together, if your muscles are strong and working normally, if those joints are moving normally, you're going to end up with essentially a spring and a shock absorber system. Now, if you have arthritis in your hip, making all of the joints around your hip work optimally is going to take a lot of the pressure off of your hip joint. If all of your joints have arthritis, which is not uncommon, if you have hip arthritis, it's not uncommon to have a little knee arthritis and a little ankle arthritis. That's normal. It's not the end of the world. In optimizing all of those joints in terms of their mobility and flexibility and strength is going to take the pressure off of those joints. And if your hip is the joint that hurts, we can often make the hip joint pain go away so that you don't have to do anything else about it. Just checking to see if anybody put anything else in the chat. Nope, we're good. And nobody has anything in the questions and answers. So if you have any questions, either type them in the questions and answer section. I'll try to answer them at the end or in the chat section. All right, so back to the worksheet just to make sure everybody's had the chance to fill in the blanks. What is the hip joint? The hip is a ball and socket joint. The hip joint is supported by muscles on 4 sides. That's the front, the inside, the outside, and the back. The 4 things that work together, that need to work together normally for a pain-free hip are the spine, the pelvis, the knee, the foot, and the ankle. Now, as we go through the rest of the worksheet, I'm not going to keep putting pictures of the worksheet up. If you have any questions as we go along or you miss something, type it in the chat or put it in the Q&A box and I'll go back to it at the end. All right, so how is it that performance physical therapy and sports medicine and myself and the therapists that work here, how is it that we came to specialize in hip pain and arthritis pain? And it really isn't just for the hip. We run workshops and seminars on the shoulder, the knee, the back, the neck, and the hand pain and carpal tunnel syndrome, because the studies are starting to show more and more over the last 20 years that you can take care of a lot of these problems with conservative treatment, and you can avoid taking medications, getting injections, or having surgery. Many people and a lot of the studies demonstrate that. So this is a picture of a particular journal and a study from 2015 that was in this journal. And they took people with arthritis pain and they randomly assigned them to two groups. Both groups just got a education about your hip, but one group got specific exercises and went to with physical therapists. They went to the physical therapist at least once a week for 12 weeks, and they got exercises to address their specific strength deficits, their specific flexibility problems. And in the group that went to physical therapy, there was a 44% reduction in the number of people that went on to get a hip joint replacement. These were all people that were contemplating hip joint replacements. So over 4 in 10 people, by just going to physical therapy and getting exercises to address their specific problems, ended up not going on to have a hip joint replacement. That's just one study. The same studies have been done for the shoulder, the knee, at least for the hip. If you have your hip replaced, you don't necessarily do worse than if you don't have your hip replaced. There are some studies, especially for the low back, that show that over time, people that have surgery may in fact do worse than people that don't. So that's basically one of the main ways that we came to specialize in it. And in the hip, you can say, so the answer for 2A is up to 44%, because that's what they found in this particular study. Up to 44% of the people may not need surgery. Now, there are other studies for other joints that show higher percentages, but we're going to go with that one because that was the study for the hip. All right, so for 2B, the answers are MRIs and X-rays are misleading. And I actually have the pictures wrong. I have an X-ray first and then the MRI second. And this is a pretty beat up X-ray. And this is where I'll talk a little bit about bone-to-bone arthritis. But the bottom line is, if you took 100 people that were 50 years old that didn't have any hip pain, and you did X-rays and MRIs of their hip, probably about 50% of them are going to have at least mild to moderate arthritis. And there's probably a few of them that'll have bone-to-bone arthritis. Now, these are people that don't have any hip pain or any limitations. And they had an X-ray and an MRI done. So the bottom line is the X-ray or the MRI doesn't necessarily mean anything. You have to not fall for the traps, and we'll talk about this again later, of going to get care for a painful hip, and it applies to the shoulder, it applies to the knee, it applies to all the joints in your body. Have a picture of it taken, look at the picture where you're gonna see that you have some potholes in it. You know, obviously this hip is in rough shape, and it's gonna make sense to you as a layperson looking at it to say, well, obviously my hip hurts because there's degeneration in there, you can see it. Well, the truth is, if you took people that were matched to you, that didn't have any limitation, and you did X-rays and MRIs, a high percentage of them are gonna have the same changes. So we it's not that we like to say it, the truth is that just relying on an X-ray or an MRI can be misleading. Now, I don't want you to think that people are doing X-rays or MRIs are trying to mislead you. Many people are trained to rely on X-rays and MRIs to make a diagnosis. We're telling you, based on the research and the literature that's out there, you need to be careful about doing that. They can be misleading findings. All right, so that's enough about that. And the other reason we've come to specialize in treating these painful conditions and trying to prevent people from taking medications, getting injections, or having surgery they may not need is because we see people that have surgery and they still have their pain. So if you have knee pain or hip pain and you have surgery and you still have pain, or you get an injection and you still have pain, we end up seeing these people in the office in physical therapy. And then if we fix their back, their hip pain goes away. Or if we fix their sacroiliac joint and their hip pain goes away, or if we strengthen up all their muscles and work on all their flexibility, their hip pain goes away. The hip may not have been the problem. So it's because of those types of things, the studies are showing people don't need surgery, injections and medications. X-rays and MRIs can be misleading. And people that we see in the office that have surgery and they still have the pain, and then we treat the other areas and their pain goes away. It's because of that that we're starting to specialize, or we do specialize in this type of treatment to prevent people from getting care that they may not need. All right. So that's kind of the scary slide I put up for 2C, because people had surgery and still had pain. I have to somehow figure out how to move this down to the bottom. I'll have to do that another day. All right. So moving on to question 3. Let me see, did anybody have anything in the chat? No, what about arthritis pain? All right. So question 3, when we see somebody in the office, I gotta just check the time to make sure I'm not going too slow. Okay. When we see somebody in the office, we wanna know, is your pain reproducible? Because generally, if your pain is reproducible, it's reducible. And what we're looking for is some sort of pattern. My hip hurts when I walk up and down the stairs, or my hip hurts when I sit and it goes away when I stand and walk, or my hip hurts when I walk and it goes away when I sit. So we're looking for clues that your pain is mechanical, because when somebody's pain is reproducible, it's generally reducible, and there's something that we can do to make it go away. We can strengthen your muscles, we can relieve the pinched nerve in your back, we can get your knee and your ankle moving, we can get your SI joint back in place or moving properly. We're basically looking for people, we can help people quicker and more successfully if there are some things that make your pain worse and other things that you can do to make your pain decrease. If your pain is a 10 out of 10 all the time, it's really hard to make you better. If you wait until your pain is 10 out of 10 all the time, it's really hard to make you better. If your pain is a 5 out of 10 when you walk for 20 minutes, but if you sit down and rest, your pain goes away, it's possible we're going to make you better. Better though, if you have pain when you sit that goes away when you stand and walk, the problem's probably not in your hip, it's probably up in your sacroiliac joint, or it often is in many people, because your sacroiliac joint is one of the most commonly missed areas that causes hip pain. All right. So the point of question 3A is, in the last 30 days, what was your worst pain and what were you doing? Something you should make a note of, because when you go to have something done about your hip pain, that's something that you should be getting asked. If you're not asked that, then you might want to move on and try to find somebody else to help you. All right, let's check. So I don't see any questions up in the chat. If anybody has any questions, type them in the chat, or you can type them in the question and answer box and we'll answer them at the end. All right. So question 4, the single biggest mistake you can make for any problem you have is to ignore it. I thought this was a cute picture when I was doing these PowerPoint slides. But ignoring it tends to sound like an excuse. My hip hurts because I'm old. My hip hurts because I take after my mom or dad and they had arthritis in their hip, so I have arthritis in my hip. We recommend you don't ignore it, because if you don't ignore it, over time it's going to get worse. If you do ignore it and don't do something about it, over time it's going to get worse. You're going to end up with 10 out of 10 pain. And if you end up in here trying to get conservative care, it's going to take a lot longer to get better. All right, so that was four. And the main blank in question 4, the single biggest mistake you can make is ignore it. You can, for A, ignore it. For B, you can mask it or alter it. And what does masking it or altering it look like? It's usually pain medication or injections. And for pain medication, what most people take is either something like Advil or Aleve. They're non-steroidal anti-inflammatory drugs. Those are medications that get rid of inflammation. Inflammation causes the pain. You get rid of the inflammation, the pain goes away, you go back to your normal activities, and what happens? The pain comes back. So one of the problems with that is you don't take care of the problems like the muscle weakness, like the flexibility issues, like your sacroiliac joint being out, like a pinched nerve in your back, that if we can take care of those other issues, will make your pain go away. The other problem with those types of drugs is that out of every 1,000 people that take those types of medications on a regular basis, like Advil or like Aleve, 3% of them worldwide will die every year. I was surprised to read that. We send out newsletters every month to referring physicians, and we also send out newsletters every month to our patients. And in researching a physician newsletter, of course, we send them newsletters trying to convince them to refer patients to us. I was reviewing a medical journal and I came across that article. So 3 out of every 1,000 people that take Advil on a regular basis for hip pain or for any other arthritic condition are going to die, and it generally has to do with bleeding in their stomach or a bleeding or perforated ulcer. Now that's something that you can just go to CVS and you can buy a 5-gallon bucket of it. 3 out of every 1,000 people every year will die from taking those on a chronic basis. The other thing you can do is you can get a cortisone injection, and a cortisone is going to knock out the inflammation. When the inflammation goes away, the pain goes away, you'll go back to your normal activities, but you really haven't taken care of the problem. And the other thing that is starting to emerge in some of the recent literature is that cortisone injections into the hip or the knee can take mild to moderate arthritis and very rapidly, and a small percentage of the population, maybe 10 or 15% of the people, you can turn that into severe arthritis where you actually have collapsing of the joint, where you really don't have any choice but to have surgery done. Doesn't matter how much we strengthen a rapidly collapsing joint, there's just nothing you can do with it with conservative care. All right, so the third thing you can do if you have hip pain or arthritis or any problem in life is you can handle it. And I guess I must have been in a golfing mood when I did these slides, because the point of this slide is to avoid the traps. So if you can't see trap because it's hidden behind my face, we're hoping that you're on this call because you want to handle it. Whoops, that wasn't supposed to happen. But we want you to avoid the traps. What happens to a lot of people if they have hip pain or shoulder pain or knee pain or ankle pain is you go to your primary care doctor. You know, your primary care doctor may give you some medication. The medication may or may not work, or it may work until the inflammation goes away. You go back to your normal activities, the pain comes back. They may give you more medication, or they may send you for x-rays. The x-rays may show some arthritis. You may end up in an orthopedic surgeon's office. You may end up with an MRI, and we've already talked about how those can be misleading. Again, I don't think they're trying to trap you into doing anything, because orthopedic surgeons are trained to fix things with orthopedic surgery and injections. Physical therapists are trained to do things with conservative care. I'm not suggesting they're trying to mislead you, trick you, or trap you into doing anything. What I am suggesting is that it may be in your best interest to give conservative care a really good try before you go on to have any of those other treatments done. And the other thing that we think it's important that you avoid is if what you're hearing is you can't get an MRI until you fail physical therapy. We see that a lot. Or I can't do surgery and make you better until you fail physical therapy. What do you think is going to happen when you go to physical therapy? I'm only here because I went to the doctor. The doctor needed to do an MRI so they could see what was wrong and fix it. But I can't get the MRI until they fail physical therapy. We have a really hard time getting you better. We'll work really hard at doing that. But if you come to us thinking that you're here to fail physical therapy so you can get the MRI to get better, that's not helpful for you. When the truth is that, at least in that hip study we talked about, 44% of the people that just did exercises specific for their strength and flexibility problems avoided having a total hip replacement. We think that's a big deal, that you have to be careful about getting yourself set up to fail physical therapy so you can have some other treatment. All right. So we're going to talk about the 3 common causes of hip pain. So I put up some rusty hinges because rusty hinges don't move, right? So there's limited movement in the, and what were the first 2 things that we talked about in the 4 areas that need to move normally in order to have a pain-free hip? Those would be the spine and the pelvis. So 2 of the most common causes of hip pain are problems in your spine and pelvis. That's even if you have arthritis in your hip. That's been seen on x-rays or because it feels crunchy when you move it around. So for 5A, the correct answers for those 2 blanks are spine and pelvis. All right, so for 5B, these are slides to remind me to talk about weakness. So this is a slide showing your core, and your core is really your lower abdominal muscles, which is really important for supporting your low back and preventing pinched nerves, or at least supporting your spine so that you can take pressure off pinched nerves. And your legs. We've already talked about the muscles around your hip. If we can keep these, if we can optimize the strength of these muscles, we can take the pressure off the hip joint. We can allow the knee joint, and I don't have a picture of a foot and ankle on these slides, but through strengthening the muscles around your hip, in your core, in your knee, and in your foot and your ankle, you can get kind of shock absorption and springiness to take the pressure off of your hip. Whoops. All right. So for 5C, the other thing that's important to work on is flexibility of the hip and leg. If you don't have flexibility in your hip, your knee, your foot, and your ankle, you can't have the springiness or the shock absorbing system of your whole whole leg doesn't work, and you might have force concentrated on arthritis in your hip, which is going to end up causing pain. So for 5, again, to go over that question, the 3 common causes of hip pain are limited movement in the spine and pelvis, weakness in the core and legs, and flexibility of the hip and leg. And instead of flexibility, it's probably stiffness of the hip and leg. So it would be weakness in the core and legs and stiffness of the hip and leg. All right, so now we're getting to the end of the presentation. Let me see if anybody has anything up in the chat. Nope. And anything in the question and answers? Nope. Okay. All right, so we're going to talk about the treatment. What does successful treatment of hip pain and arthritis look like? And of course, we're talking about conservative care. And it's hands-on treatment to move the spine, the pelvis, and hip joints, also the knee and the ankle. Most people, when they end up in our office, if we're treating you for hip pain, we're going to be working on your low back, your sacroiliac joints, your hip joint, your knee, and your ankle. And it's going to involve hands-on care in order to get your spine moving, to relieve any pinched nerves, to get your SI joints in place, to get your SI joints moving, to get your hip joint moving, to get your knee and your ankle moving. Because if we get everything moving optimally, we can take the pressure off of your hip joint and get rid of your hip pain and get you back to normal naturally so that you can avoid taking medications, getting injections, or having surgery that you may not need. We're also going to work on strengthening, and clearly we're going to strengthen the muscles around your hip. We're also going to work on your core. We'll work on your back muscles. We're going to work on your hip and knee muscles. That's to address the weakness. I know this is getting a little repetitive. These are basically the same answers as in question 5, but we're also going to do strengthening, or we're also going to do stretching in order to address stiffness. So 6A was hands-on PT to move the spine, pelvis, and hip joints. 6B are strengthening and flexibility exercises. And the flexibility exercises are for stiffness. And then sometimes, and more often than not these days, we use dry needling, and we also are using class 4 laser. Now, dry needling is not something that's that unique to our office. At least 50% of PT offices in Connecticut are pretty routinely using dry needling. It's the same type of needle that's used in acupuncture. We use the needles to relieve trigger points, which are areas of hypersensitivity and stiffness in the muscles. And we do that just to kind of speed things along. If you don't like needles, we don't use them. You'll still get better. It just can take a little bit more treatment to get it better. It's just something to speed things along. The class 4 laser is something that is a little bit unique to us. Class 3 lasers are fairly common in physical therapy. The bottom line is we can add healing energy and we can block pain with a class 4 laser. In about 5 minutes, we can put in as much energy as a class 3 laser takes about 8 hours to do. So it's a much more effective way to get rid of pain and enhance healing or speed up healing in a very short period of time. In our Colchester office, we have a 25-watt laser, and in our Hebron office, we have a 40-watt laser. So it may take them 3 minutes to do what it takes us 5 minutes to do in the Colchester office, but it's still a pretty convenient way to kind of move things along. All right, so that's all I have for my presentation. And I'm just going to check the chat real quick. Nobody has any questions in the chat. And I don't see anything in the question and answer. But for those coming, signing up for our webinar and sitting through the webinar, I know you may not be able to see what this says in the corner. It actually says discovery visit. And we can do these visits online or in the office. Our offices never closed down during the corona COVID virus emergency. We're an essential service, and we've been open, hopefully to take some of the pressure off of the rest of the healthcare system. But we are set up to do either online or in-office screening visits with people. So for coming to the webinar, our offer to you is to go to performanceptworkshops.com. You fill in this form, put in your email and your phone number, click the register button. Somebody from the office will give you a call, and we'll set you up for a complimentary free screening visit. You'll come in, you'll meet with one of the physical therapists. We'll go over things. We'll look at your back, your hip, your knee, and your ankle, tell you what we think is causing your pain, go over what we think treatment would look like for you. We'll often do a little bit of a trial treatment or teach you some exercises you can work on your own. And then you can decide if you want to give conservative care a try. If you don't want to fill out the form and click the button, you can call our offices and get set up for a discovery visit. Our Hebron office is where all of our workshops are coordinated out of. And the phone number for the Hebron office is 860-228-4883. Of course, you can always call the Colchester office and they'll be able to help you as well. So to set up your free discovery visit, go to performanceptworkshops.com, fill in the form and click the register button, and they'll get you set up for a free complimentary discovery visit. Just going to check and see. Whoops. All right, sorry about screwing that up. I'm going to see, does anybody have any questions in the chat? It doesn't look like it. Any questions on the question and answer? No? All right. So we had 7 of you guys on our call. I really do appreciate your registering for this workshop and coming to our webinar. And I hope that you'll go to performanceptworkshops.com, fill out the form, click register, and we'll get you set up for a free discovery visit. All right, thanks for coming.